Have you ever thought that diabetes is something you only need to worry about during the day when you're watching your carbs and sugar? What if I told you that while you sleep, diabetes could be trying to give you important signals? Today, our mission is not only to inform, but also to enlighten you about this. Let's reveal the 12 nighttime signs of diabetes that you can't ignore. You may be fine during the day, but what about at night when the sun goes down? Ignoring these signs is not only dangerous, but it is a mistake that even the most careful people make. And some of these signs are more treacherous than you imagine. Get ready to discover important things on this journey that will be very enlightening. Before we continue, if you like learning about health and want more tips, click the like button and subscribe to our channel. Trust me, you'll want to see everything until the end. For the American Diabetes Association, diabetes in the USA costs around $327 billion per year. This includes medical expenses and lost productivity. But can we put a price on our health and a good night's sleep? Shocking data from the Journal of Clinical Sleep Medicine shows that diabetes doesn't stop even while we sleep. Ignoring this can be a big mistake, both for your wallet and for our health. So stick around, because today we're going to reveal the 12 nighttime signs of diabetes that you can't ignore. This information is super important and can save lives. Is ready? Let's start with number 12. Snoring. Pay attention. Snoring may seem like just an annoying noise that disturbs your partner and even the neighbors. But did you know that this sound could be a sign of something much more serious? According to research in the magazine Sleep, people who snore regularly are more likely to develop insulin resistance, a warning sign of diabetes. So what happens to your body when you snore? Well, every time you snore. When you snore, you are actually having small interruptions in your breathing. These breaks can activate stress responses in your body, increasing stress hormones like cortisol. High levels of these hormones can mess with your blood sugar levels, which is a huge risk for developing diabetes. If you're snoring, there are a few simple things you can try before you worry. Changing some habits, such as losing weight, reducing alcohol consumption, and even changing your sleeping position, can help reduce snoring. For example, trying to sleep on your side instead of your back can make a big difference. But if you've tried these tips and are still snoring loudly, it's time to take it seriously. See a doctor for a detailed sleep study and possibly a diabetes screening. This is very important. Remember, prevention is always better than cure, especially when it comes to your health. So the next time you hear someone snoring loudly, don't just cover your ears with a pillow. Think of it as your body's alarm letting you know it's time for a checkup. Snoring can be an important sign about your health that should not be ignored. Our next stop is to talk about sleep disorders. We're not just talking about tossing and turning in bed or having a nightmare every now and then. We're talking about disturbances that wake you up and leave you agitated and restless. According to a study published in the Journal of Sleep Research, these sleep disorders may be linked to blood glucose control, worsening diabetes symptoms. If you wake up often during the night or have trouble falling back to sleep, this could be a warning sign from your body. To improve, make your bedroom a perfect place to sleep, use dark curtains, white noise, or practice relaxation techniques. If the problems still persist, it's time to talk to your doctor. Persistent sleep disorders may need further investigation and sometimes medication to regulate your sleep. So, pay attention to your body's signals and take good care of your health. Now let's move on to number 10, leg cramps. Anyone who has ever had leg cramps knows that it's like your muscles are suddenly stuck. Imagine feeling this when you're trying to rest. But did you know that these painful cramps can be linked to high blood sugar levels? That's right. When your body can't balance sugar and electrolytes properly, cramps can happen. To relieve leg cramps, you can try drinking plenty of water, doing light stretching exercises, or even massaging the affected area. However, if cramps persist or become more frequent, it is crucial to see a doctor. This may indicate an imbalance that should not be ignored. Now let's move on to number 9, night sweats. Sweating at night can happen for a variety of reasons, from having a nightmare to sleeping in a hot room. But it can also be a sign of low blood sugar levels, known as hypoglycemia. There are some home tricks for dealing with night sweats, such as adjusting the bedroom temperature, using light, breathable bedding, or taking a cool shower before bed. But if night sweats persist, it's essential to speak to a doctor. Night sweats may be your body's way of warning you that your blood sugar levels are dangerously low. Trust me, this is one sign you don't want to ignore. We come to sign number 8, which is especially interesting but often overlooked. Dry mouth. Imagine waking up in the middle of the night with your mouth as dry as the Sahara Desert, even though you're comfortable in your air-conditioned room. This isn't just a nuisance that a sip of water solves. Dry mouth, medically known as xerostomia, can be a clear sign of diabetes affecting your salivary glands. According to new research published in Diabetes Care, there is a link between dry mouth and high glucose levels. And if left untreated, dry mouth can lead to more serious dental problems such as cavities, gum disease, and even oral infections. To relieve dry mouth, you can drink water at night or chew sugar-free gum to stimulate saliva. There are also over-the-counter saliva substitutes that may help temporarily, but if you notice that this symptom persists night after night, see a doctor. Dry mouth may be just the beginning of more serious health problems that need a thorough approach to treatment. Now, let's move on to the next crucial and often overlooked nighttime sign: changes in vision. Yes, I'm talking about those times when your night vision seems blurrier than usual, or when you have trouble adjusting to darker environments. This is not something to ignore. Studies published in the journal Ophthalmology show that persistent vision problems can be early warning signs of diabetes-related eye complications, such as retinopathy or even cataracts. Therefore, if you notice any changes in your vision, especially at night, it is important to see a doctor. These problems may be signs that your diabetes is affecting your vision and need to be treated as soon as possible. Your quality of life is very important and should not be ignored or attributed solely to aging. So what can you do if you are experiencing vision problems? First, give your eyes plenty of rest, especially if you spend a lot of time looking at screens before bed. Glasses that block blue light can help reduce eye strain. A balanced diet rich in vitamins A, C, and E is also great for maintaining eye health. But if you notice constant changes in your vision, especially at night, it's time to see an ophthalmologist for a full exam. Changes in vision can be a warning that something is happening internally. A detailed eye exam not only assesses the health of your eyes, but can also reveal health problems you didn't even know you had. Remember, prevention is always better than cure. Now, let's talk about a sign you may not be noticing: restlessness or irritability. We're not just talking about an occasional bad mood. Studies show a direct link between diabetes and mood swings. According to research published in the journal Diabetes Care, people with diabetes are more likely to suffer from depression and irritability. Think about it. You're trying to relax, but you feel restless or fighting with your loved ones for no apparent reason. This may be related to diabetes. High blood sugar levels can interfere with your body's neurotransmitters, affecting your mood and causing that feeling of restlessness or irritability. A study in psychological neuroendocrinology revealed that fluctuating glucose levels may be linked to mood disorders. To alleviate these symptoms, try to rest more, maintain a balanced diet, and, if necessary, consult a doctor for an appropriate treatment plan. Remember, taking care of your mental health is just as important as taking care of your physical health. The best way to keep blood sugar levels balanced is through medication, proper diet, and regular exercise. Behavioral therapies, such as cognitive behavioral therapy, have also been effective in treating diabetes-related mood symptoms, according to a study published in the Journal of Diabetes Research. But if these symptoms persist, it's important to consult healthcare professionals for a full diagnosis and personalized treatment plan. Your emotional well-being is just as important as your physical health, especially when dealing with diabetes. Now let's talk about a topic that sounds sweet but isn't good at all: fruity breath. Breath that smells sweet or fruity can be a sign of ketoacidosis, a serious condition that can be fatal if not treated quickly. If anyone notices this type of odor on you, seek medical attention immediately. This is a red alert that should not be ignored. And speaking of signs that we should not ignore, let's move on to the next one: frequent night thirst. If you find yourself drinking a lot of water at night, as if you were in the desert, it could be a sign of diabetes. High blood sugar levels draw moisture from your tissues, leaving you thirsty. To manage this, it's important to keep your sugar levels low, monitor your glucose regularly, and follow a diabetes-friendly diet. If your thirst persists, consult a healthcare professional for a full evaluation and treatment plan. Now, let's move on to number 3, nocturia, or the annoying habit of urinating frequently during the night. Waking up once or twice to use the bathroom is normal, but if it happens more frequently, it could be a sign of diabetes. High blood sugar levels make your kidneys work harder to eliminate excess glucose, resulting in more trips to the bathroom at night. To alleviate this, monitor your sugar levels and talk to your doctor about strategies to better manage your diabetes and avoid sleep disruptions. However, if you find yourself going to the bathroom more often at night, your body may be signaling a more serious problem. Deep. According to research from the Journal of Urology, nocturia is associated with high glucose levels in the body. Yes, those frequent trips to the bathroom can be more than just a nuisance. They can be a warning sign of diabetes or its complications. To try to reduce this, avoid drinking a lot of fluids a few hours before bed and stay away from diuretic substances like caffeine. If this doesn't help, see a doctor for a full evaluation. The quality of your sleep is worth it. Next on our list is something that not only disrupts your sleep, but also puts your health at risk. Sleep apnea. These pauses in breathing during the night can be more than just the cause of annoying snoring. A study published in Chest Journal linked sleep apnea to insulin resistance, a precursor to diabetes. Sleep apnea not only affects your rest, but can cause serious problems throughout your body. Having a professional sleep study can identify the severity of your apnea and determine the best treatment options for you, which may include devices like CPAP machines or even surgical procedures. And now, the moment we've all been waiting for, the number one sign that you absolutely cannot ignore at night: hypoglycemia. This is not just another symptom, it is a critical concern that requires immediate attention. Nocturnal hypoglycemia happens when blood sugar levels drop drastically during sleep. This is extremely dangerous and can result in serious complications, including seizures or even a diabetic coma. How can you protect yourself? First, regularly monitor your blood sugar levels, especially before bed. Second, eat a balanced meal or snack before bed to stabilize your sugar levels. Third, if you're at risk, set alarms to check your blood sugar at night. And here's an important tip. If you experience symptoms like excessive sweating, heart palpitations, or even vivid nightmares, see your doctor immediately. Remember, all of these signs are important and should not be ignored. Taking care of your health during the day is crucial, but paying attention to the signs at night can make a big difference to your quality of life and overall well-being. This is not the time for self-diagnosis or searching for remedies on the internet. Your life and well-being are at stake. All right, folks, we're nearing the end of our journey through the 12 night signs of diabetes you can't ignore. Today we've covered a lot, from snoring to the dreaded nocturnal hypoglycemia. Remember, your body has a language, and these nighttime signals may be your way of sounding the alarm. So what's your next step? Will you listen to what your body is trying to tell you, or will you risk ignoring these critical signals? Make your health a priority. Take care of yourself right now. If you found value in today's video, go ahead and hit the like button. This helps us reach more people like you who need this crucial information. Also, if you haven't already, hit the subscribe button and turn on the notification bell so you never miss out on future videos that might be eye-opening for you. And if you have any thoughts or personal experiences related to tonight's topic, feel free to share it in the comments section below. Your insights could make all the difference to someone who is facing similar issues. Alright, that's a summary of today's video. We'll be back soon with more eye-opening content to help you live your healthiest life. Until then, take good care of yourself and others. Stay healthy.